Good morning. My name is Kaylin Finney, and today we'll be going over epilepsy, the biological mechanisms, and the neural biases. What is epilepsy? Epilepsy is a chronic neurological disorder characterized by recurrent, unprovoked seizures. It affects about 50 million people worldwide, and seizures usually equal abnormal electricity activity in the brain. What happens during a seizure? Usually the body tenses up, the eyes may roll back, you lose all control of your own body. What also happens is that neurons fire excessively and synchronously. It disrupts normal brain communication, as well as it can affect movement, as I said earlier, awareness, sensation, and behavior. The different types of seizures. We have focal seizures. It begins in one area of the brain, and generalized seizures, which involves both hemispheres of the brain. We have a few examples, which are tonic clonic seizures and absence seizures. I have been around a few people who have been involved or who have had seizures and or epilepsy, and I've seen both versions of them. And then my site, you can't see it, but once you look at the PowerPoint, it's on there, but it's at the bottom. The different biological mechanisms are, they have it's an imbalance in between excitatory neurotransmitters and inhibitory neurotransmitters, and it leads to neuronal hyperexcitability. Also, it causes dysfunction within the ion channels. I honestly found that a little interesting because I didn't know anything about that until I actually did the research. So I appreciate that. Some brain structures that are involved, the common regions, which are temporal lobe, hippocampus, cerebral cortex, and then the structural abnormalities would be like tumors, scarring, and developmental issues. With my sister, she has epilepsy, and one of the things that we make sure to focus on is to see if there's any developmental issues or anything like the lack of brain oxygen or anything along those lines, to make sure she's okay and developing how she needs to in her life. What are some different causes of epilepsy? Genetic mutations, brain injury, as in traumas or strokes, infections, meningitis, developmental disorders that also causes them, and then there are sometimes unknown causes. I believe I had a form of epilepsy too, but I thankfully grew out of it, and that's where we're hoping for the same for my sister. We started having seizures whenever we got too hot internally. I did forget the name of it, but that was our case, and it still is. Diagnosis: we have EEGs, which detects abnormal brain waves. I've taken that before, and so have my sister. I know I keep bringing it up, but I have a lot of personal experience with this. So yes. We also have MRI and CT scans, which identify structural damage within the brain. And we also have clinical history. Like, it could have just started, and now they're trying to find a solution from there and trying to find a way to cure you. And that's with different medicines and different liquids and scans, as I stated before, the slide before. What treatment options do we have? We have an antiepileptic drug, which increases GABA or decreases excitation. We have surgery, and we also have the vagus nerve stimulation. Why does biology matter within this? Because it helps develop targeted treatments, it improves seizure control, and it also advances neuroscience research. And with research, that's how we get what we need today. In conclusion, epilepsy is caused by abnormal brain activity, as I stated earlier. It's linked to neurotransmitter imbalances and neural dysfunction. And it also, understanding biology improves treatment and outcomes, as I stated on the last slide. If without research, we wouldn't have answers. These are my references. Let's screen down. Thank you so much. Have a nice day.